Scientists used low-intensity ultrasound waves to treat an aggressive and fatal brain tumor. The ultrasound device is implanted in the skull and uses tiny bubbles to open the blood-brain barrier to deliver drugs to the brain. The blood-brain barrier is a thin, protective layer of specialized cells lining the very small blood vessels guarding the human brain. It keeps out the bad stuff, such as pathogens, but it also prevents potentially useful things from getting in. As a result, virtually all medications for conditions such as brain cancer and neurodegenerative diseases are effectively unable to reach the site where they are needed most. The challenge is that the brain is an extraordinarily fragile organ. Any damage is irreversible, which is why researchers want new strategies to bypass the blood-brain barrier. Methods such as surgical injection have been tried in the past, but they involve skin incisions, holes in the skull, and passing instruments through the brain. This carries a risk of infection, bleeding, and swelling, which could cause permanent brain damage. The focused ultrasound technique is a non-invasive way to open the blood-brain barrier. In Phase 1 clinical trial, the ultrasound device was implanted in the skull of 17 glioblastoma patients. A few weeks later, their treatment began with common chemotherapy drugs. In normal circumstances, these medicines do not cross the blood-brain barrier, but the ultrasound device works by making tiny bubbles vibrate inside the brain's blood vessels, temporarily making the protective outer layer permeable. The researchers found that opening the barrier led to a 4 to 6-fold increase in drug concentrations in the human brain. The study also showed how quickly the blood-brain barrier closes after being opened by the ultrasound. It closes in the first 30 to 60 minutes after the communication. This will help scientists optimize what order to deliver the drugs to allow for better penetration of the brain.